Hi guys, it's me. I want to answer this question that keeps coming up over and over and over. Some of you already know about it, some of you don't. So I stopped losing weight on a low-calorie diet, okay? So people are maybe in their 40s or 50s, they started this low-calorie diet and it's just not working anymore. So here's the data on that. The first time you do it, it probably will work in your 20s, okay? Then over time, every time you do it more and more, the less it works, to the point where it just doesn't work at all anymore. And I'm talking about Weight Watchers, I'm talking about counting your calories, I'm talking about HCG diet, which is 500 calories, okay? Why is it the more time you do it, the less it works? It's because dieting slows your metabolism, okay? Why? Because it's a form of starvation. It's really about the nutrient deprivation. So when you cut down the nutrients, your body compensates. If you don't have enough fuel to run the body, it will compensate by slowing down the metabolism. It's basically learning how to do it. So here you are when you're 40 or 50 trying to do a low-calorie diet, when someone might say, well, it's just your metabolism is low. Well, actually, it's because the diet created it in the first place. Why would you want to do a low-calorie diet now? You know it's going to just make things worse, okay? So what is the missing piece? What do you need to know to reverse this? Let's talk about that. Here's what you need to know. Number one, not all calories are the same, okay? Carbs, protein, and fat, you can't treat those the same by lowering general calories because each one of them are involved in hormonal interactions very differently. So different types of calories respond to hormones differently, okay? So you really have three macronutrients. You have carbs, protein, and fat, right? So now I'm going to use this book right here, Guidance Physiology, on page 927. And let's just see what it says right here. The first thing I'm going to talk about is all aspects of fat metabolism are greatly enhanced. Now, aren't we trying to metabolize fat? Yeah. All aspects of fat metabolism are greatly enhanced in the absence of insulin, okay? So insulin is the hormone we need to bring down. Okay, and it also says up here, insulin inhibits the action of the hormone-sensitive lipase. Well, insulin inhibits this enzyme that's supposed to dissolve fat. So again, we want to inhibit insulin. And then it says right here, therefore, when insulin is not available to promote glucose entry into the fat cell, so basically one of the functions of insulin is to help you absorb fuel, glucose fuel in the cell. When it's not available to do that, fat storage is almost totally blocked. So you're not going to store fat anymore if you actually lower insulin. You're going to enhance the metabolism of fat. So really, what we want to do is we want to get this insulin thing down. That will restore the metabolism. That will restore your set point so you can actually go lower and lower and lower and not be stuck at a certain weight. So let's take a look at the three things, carbs, protein, and fat, okay? Carbohydrates. That's the thing that increases insulin. So we want a low carbohydrate diet. Protein. Well, protein also is triggered by, can trigger insulin as well if it's too much. So a moderate amount of protein would be fine. So you can have 3 to 6 ounces per meal, and that would be fine, but don't do massive amounts of protein. That's going to increase insulin. And by the way, the lower the fat in the protein, like a protein powder, the more the insulin spike. Whey protein being the highest. So we want fat with the protein. You don't want to go low fat anything. And so that's kind of probably conflicts with what you've been doing and what you've been taught. And maybe you heard of the glycemic index, the index of all the carbohydrates that can activate your blood sugars, right? Well, there's also an insulin index, I read about in my book, that shows you all the non-carbohydrate things that can increase fat. So fat has the least effect on insulin. Okay, so fat is not the thing you want to worry about. And the other factor to trigger insulin is frequency of eating. If you're eating 5 to 6 small meals a day, every time you eat, you spike insulin. So we want to have less frequent meals. It's called intermittent fasting, but make sure you don't reduce your nutrients and your calories. So again, a lot of you have already heard this a million times, but this is for the person that has not heard this. It's very important. So you want to lower this and you can start to lose weight and restore your metabolism. Thanks for watching. Hi guys. Hey, listen, I created a pretty amazing evaluation quiz down below that actually analyzes your symptoms to find the cause, the root cause of all of your symptoms, the most likely cause. So take the quiz now, and we'll send you a report.